Hello and welcome. I'm Larry Bowe, the Chief Executive of Providence Holy Cross Medical Center. During your stay with us, our staff of physicians, nurses, and their support team are committed to deliver care in a compassionate and respectful manner. Your comfort and access to quality care is of great importance to us. Together, we are dedicated to providing the skills and services necessary to give you excellent, family-centered care. Thank you for taking a few minutes to view this orientation video. We hope it will answer your most immediate questions and concerns about your stay here with us.
Hi, my name is Sarah, and I'm a registered nurse here at Providence Holy Cross Medical Center. I'm going to talk about what you can expect from our staff and how you can become an active member of your wellness team. If you haven't already received an in-person orientation, I want to point out a few things about your room. Your nurse and nursing assistant will go over everything in more detail, so don't worry if you have more questions after watching this video. First, the nurse call button is located on the remote by your side. Use this red button to call for assistance whenever you feel you need help. For example, when you're getting in or out of bed, it's easy to slip and fall if you feel weak or unfamiliar with the room. Press the red button to let the monitor at the central desk know you need assistance. The monitor will notify your nurse, and they or another member of their team will come to your assistance as quickly as possible. This remote also includes controls for the lights and television in your room. In addition, you can control your bed head and foot position by using the buttons on the side rail. For your safety, we usually keep 2 side rails up while you are in bed. During your hospitalization, you may be connected to a heart monitor, IV pump, and other equipment. These devices are monitored at all times. You may hear beeps and other sounds from the medical equipment in your room and in the hall. These noises are part of their normal operation, so you don't need to worry about them. But please do ask if you want us to explain any sounds to you. Cell phone use is only permitted in designated public areas of the hospital. We ask that you and your family turn off your cell phones in the room so it does not interfere with any medical equipment. You can use the phone provided to make calls from your room. Your room has a few small storage areas for essential personal items. We recommend that you place eyeglasses or hearing aids in the tray drawer, or that you label them and keep them in a visible location. Space is limited, so please give any valuables and non-essential items to a family member or friend who can take home anything you do not need. And please make sure your nurse is aware of any valuables you would like placed in the hospital safe, because we cannot accept responsibility for any items kept in your room. Educating yourself about your care is one of the most important ways you can participate in your own recovery. The care board in your room is updated each nursing shift with information about your wellness team and your daily plan. This includes any tests or conditions we are monitoring that day. You should also choose an advocate, a family member, caregiver, or close friend that you can trust and that you communicate well with. Your advocate will be a spokesperson if and when you need one. They will help us maintain your privacy by acting as the designated contact person to share information that you want with other family and friends. We also recommend completing an advance directive to legally declare your choices about medical treatments in the event that you are unable to make decisions yourself. You and your advocate play a vital role in making your care safe by speaking up if you have any questions or concerns. Here are 3 examples of times we encourage you to speak up.
Hey, Mr. Smithers. How you doing?
Hi, doctor. How are you?
All right?
First, if you don't see hospital staff, including your physician, wash or sanitize their hands each time before providing your care, please ask them if they have. We also ask that patients, family members, and visitors wash their hands or use hand sanitizer frequently to stop the spread of germs while in the hospital. Second, if staff does not verify your name and medical number on your wristband each time they give you medication, draw blood, or perform a procedure, please ask them to check to make sure they have the correct patient. And third, if someone enters the room that you do not recognize or is not wearing a Providence badge, please ask them to identify themselves. In addition to your physician and the nursing staff, other individuals who may enter your room include a respiratory therapist, a case manager, a discharge planner, and the housekeeping staff. The nursing staff will be rounding throughout their shift to provide for your safety, comfort, and any personal needs you require. They will also be asking you several times a day about minimizing and controlling your level of pain. We use a 0 to 10 pain scale to rate pain. You can help by telling us exactly when and where you feel pain, and also if the pain medication is or is not working. At the start of your hospitalization, your nurse will review your medical history, medication, and treatment plan with you. It's very important to us that you and your advocate know as much as possible about your diagnosis and treatment. Your orientation packet has a list of recommended questions to ask your doctor or nurse. If there's anything you don't understand, you don't need to feel rushed or embarrassed. Just ask again. Your doctor will be coming to see you once a day while you are in the hospital. However, the exact time your doctor visits may change day to day, depending on their schedule with other patients. If you do not have a primary care doctor, or if they are unable to see you at this hospital, another attending doctor has been assigned to you and will be caring for you while you are at Providence Holy Cross. And finally, your physician has prescribed a diet for you based on your condition. A nutrition care representative will visit you between the hours of 9 and noon to discuss your menu and to review any restriction and allergies with you. Your nurse will go over the materials in the orientation and admission packet. This packet includes information on visiting hours and policies, cafeteria service, spiritual care, and other information you will want to know while you are here. The packet also lists phone numbers for patient relations and other hospital departments that you may wish to contact. If you have questions or concerns about your insurance or bill, please contact our financial counselor. As a nurse here at Providence Holy Cross, I personally appreciate you taking time to watch this orientation video. Please know you are the key member of your wellness team, and we encourage you to become involved in your healthcare. Ask questions, tell us your concerns, hopes, and needs related to your care and treatment. With your assistance, we can work towards our mutual goal, giving you excellent care in a supportive environment. Thank you.